Why is proper cannulation crucial for a successful pancreatic ERCP? Imagine trying to unlock a complex door with the wrong key. That's similar to what happens if cannulation isn't done correctly during a pancreatic endoscopic procedure. When doctors perform an endoscopic retrograde cholangiopancreatography, or ERCP, they need to carefully insert a tiny tube or guide wire into the pancreatic or bile ducts through the major papilla in the duodenum. This step is vital because it sets the stage for both diagnosis and treatment. Getting the cannulation right ensures that the doctor can see inside the ducts clearly, take tissue samples if needed, and perform interventions like removing stones or placing stents. If the cannulation isn't precise, the doctor might miss the duct entirely or cause damage, which can make the procedure less effective or even risky. For patients with pancreatic cancer, accurate access to the pancreatic duct can help determine how advanced the disease is and guide treatment options. Another reason proper cannulation is so important is to reduce the chance of complications. If the doctor struggles to access the duct repeatedly, it can cause inflammation of the pancreas, known as post-ERCP pancreatitis. This condition can be serious and sometimes requires additional treatment. By using careful techniques from the start, such as guiding the wire gently into the duct and avoiding unnecessary attempts, the risk of inflammation drops significantly. Injury to the delicate tissue of the pancreatic or bile ducts is another concern. Improper cannulation can cause tears, swelling, or even perforation, which can lead to further health issues. Skilled endoscopists use specific tools like guide wires and sphincterotomes to navigate these tiny channels safely, minimizing trauma and ensuring the duct's remains intact. Sometimes, initial attempts at cannulation are difficult, especially if the anatomy is altered by disease or previous surgeries. In these cases, advanced techniques like the double guide wire method or pre-cut sphincterotomy can help. Proper initial cannulation makes it easier to use these salvage techniques if needed, increasing the chances of success without causing harm. Understanding the anatomy of the pancreatic and bile ducts, especially in cases of pancreatic cancer, is also key. The doctor must position the endoscope correctly and manipulate the guide wire with precision. This careful approach allows for selective cannulation, meaning they can target just the duct they need to access. When done properly, it improves the chances of a successful procedure and provides the best possible information for diagnosis and treatment. In essence, proper cannulation during pancreatic ERCP is the foundation of a safe, effective, and accurate procedure. It helps doctors see inside the ducts clearly, perform necessary treatments, and avoid complications like pancreatitis or duct injury. For patients with pancreatic cancer, this precision can influence how well the disease is understood and managed. Always remember, a skilled endoscopist uses careful technique, the right tools, and a thorough understanding of anatomy to make sure the procedure is as successful and safe as possible. If you or someone you know is considering an ERCP, discussing the experience and expertise of the medical team is an important step.